So today I will speak about summary of CESR pathway, mainly in obstetrics and gynecology. I will start with CESR essential requirement, which are full GMC registration, membership of Royal College of Obstetricians and Gynecology, or equivalent, proof of specialist training, which must be approved by the Royal College. Till now, these are the only qualifications considered and accepted are equivalent to the MRCOG. So American Board of Obstetricians and Gynecology, membership of Royal Australian and New Zealand College of Obstetricians and Gynecologists, fellowship of obstetricians and gynecology from the Royal College of Physicians and Surgeons of Canada, fellowship of the College of Surgeons of South Africa. Now, coming to the essential training. The training must cover all the obstetrics and the gynecology curriculum, and this is actually the same for the CCT, and the best guidance is the RCOG training portfolio. So the curriculum is structured with 4 professional identities, or PI, divided to generic and specific. The professional identities are supported by 14 high-level learning outcomes known as capabilities in practice, or SIP. Each SIP is supported by several skills. If you have already started your MRCOG training portfolio, you will be very familiar with these slides, but I will go through it quickly just in case you are not familiar with it. And also, please, if you haven't started your MRCOG portfolio and you're planning for CESR, this is the best way to start through MRCOG. So PI1 is healthcare professional. SIP 1 covers medical knowledge, clinical skills, and professional values. SIP 2, successful work within health organization. SIP 3 mainly is about leadership and your engagement in management and delivering results. SIP 4, quality improvement project or interventions, because as you know, here in UK, it is very, very important. It's not only clinical work, it's about audit, risk assessment, and quality improvement project like research as well. SIP 5, basic human factors, principles, and practice as individual, team, organizational, and systems level. PI2 is mainly about research and education. SIP 6, the doctor takes an active role in helping self and others to develop. So you must be involved in teaching sessions, formal and non-formal, and you have to get the certificates for these teaching sessions. SIP 7, the doctor is able to engage with research and promote innovations. SIP 8, the doctor is effective as a teacher and supervisor of healthcare professionals. PI3 is a clinical expert. SIP 9, management of emergency in gynae and early pregnancy. So all your management of gynae cases and early pregnancy, like ectopic, miscarriage, any emergency or early pregnancy, you can put on the management of emergency. Management of emergencies in obstetrics, all your obstetric management, starting from cesarean sections, emergency sections, or emergency management of PPH or shoulder dystocia, all of these comes under the emergencies, or you can put it in SIP 10 in your portfolio. SIP 11, management of non-emergency gynecology and early pregnancy. You can include here all the patients you have seen in clinic or any management. You can present this by CBD or mini KEX. I will go through it in a few minutes. SIP 12 is management of non-emergency obstetric case. PI4, champion for women's health. It includes SIP 13, which is the doctor able to champion the healthcare needs of people from all groups within society. SIP 14, the doctor takes an active role in implementing public health priorities for women, work within local, national, and international structures to promote health and prevent disease. Right. So before you apply for ATSM or CESR pathway, we agree that you have to cover all what I mentioned before, which is the PI and SIP from the training portfolio. And also, it is a must that you complete ATSM's Advanced Training Skills module, at least 2 of them. And please be careful when you choose your ATSMs, because it should be equivalent to all the previous steps we have mentioned and covered. Right, so you have to get 2 ATSMs. You have to submit your appraisal as well. These appraisals should be sequential annual appraisal along with personal development plans must be provided from the last 5 years. It must include your appraisal from the last 12 months. Summaries of appraisals can be presented for past years, except for the most recent one, which should be submitted in full. So please be careful about appraisals because they are very, very important, and you need to submit the last one in details. You have to submit 3 clinical audits from the last 5 years. You can submit the audit either as audit report or audit presentations. Please remember, and it's very important, that audit evidence must demonstrate that you have completed the 5 stages of audit process, including re-audit. And actually, it is a common mistake and common reason for rejection from the Royal College or the GMC, because most of the candidates will apply for audit, but they didn't close the audit loop by re-auditing. So make sure that when you audit, re-audit again. I will talk here about other required and essential, actually, clinical evidence. So make sure that all recent clinical evidence should be provided from the last 5 years. You should provide 24 of balanced mixtures of CBDs and mini-kicks, and that should be equally divided between obstetrics and gynecology. You can discuss a CBD as a case discussion with your colleague or a consultant or any even junior doctor. And mini-kicks, you know that it has to be like with a bit of supervision. For non-technical skills like notes, assessment should be provided. And again, you will find these notes in portfolio, RCOG portfolio. You can create a note. For example, if you are doing night duty with non-resident consultant in labor room, it will be a very good opportunity to create a note. You should submit 10 reflective pieces from the last 5 years. For the OSATs, the minimum number is 3 summative OSATs for each surgical procedure, 5 examples of case history, medical report covering both obstetrics and the gynecology, and here from the last 3 years only, not 5 years. 5 referral letters with replies, so in total it will be 10 letters from the last 3 years. Mix your letters, either you have written to colleagues as well as letters you have written to you. The letters has been written to you as a reply. 5 letters, cards, or email conversations with colleagues demonstrating good team working relationships from the last 3 years. So if you have been appraised by your supervisor, clinical supervisor, or your colleagues, please make them write to you because this writing is very important evidence. 5 letters you have written directly to patients regarding their treatment and or diagnosis appropriately from the last 3 years. And here you can use, if you are dictating letter in your gynae clinic or obstetric clinic, you can keep this as evidence. 3 full sets of minutes from multidisciplinary team meeting from the last 3 years, demonstrating your attendance and participation, not only attendance. You have to submit employment letters and contracts of employment, and these letters must match your CV, dates you were in the post, title, grade, training type of employment, either it is permanent or fixed term or part-time, and you should include also the percentage of if you're working part-time. You must submit samples of your rota from an annual cycle to cover the last 3 years, and that should demonstrate your weekly clinical and non-clinical activity across both obstetrics and gynecology. Departmental annual case load statistics, and you can easily get this from your hospital, again from the last 3 years, including information about the delivery rate, total number of outpatients, annual access to clinic, wards and theaters, total number of each clinical procedures undertaken annually by the department across both obstetrics and gynecology, range and the scope of work undertaken within your trust. It means the size of the hospital you work at. And definitely, if you have changed your hospital in the previous 3 years, you have to get all this information separately about each hospital you worked in. You should submit 2 statements of account or letters you have written in response to complaint you have been involved in. So you can choose either direct or indirect involvement in a complaint, and you have to reflect and write a statement of these letters. As you know, UK practice is mainly now encouraging reflective practice. 3 full sets of minutes from clinical governance meeting or risk assessment meeting you have attended from the last 3 years. And again, these meetings are very important. You should get feedbacks from your colleagues. These must highlight your communication skills and relationships with colleagues, patient, multidisciplinary team. And definitely try to choose the positive or the most positive feedbacks to submit. And if you are working already in NHS, you know the 360 feedback system. You need to complete the following course and you submit the certificates. Information governance, data protection training must have been completed in the last 12 months. And these usually, if you're working in NHS, it will be through the mandatory training, or you can ask the trust to schedule you for these important courses. Communication skills, formal course is strongly encouraged, and there's a reason. Usually also, if you're coming abroad from the UK, they will advise you to do the communication skills on joining. You should do breaking bad news, face-to-face course or class-based training. Please remember, and it is very important, that you anonymize your evidence before you submit. So you must remove all patient identifying with details of patient's relative or details of colleague. And this is your medical legal responsibility, and it can be a serious issue if you don't do that in GMC. So you don't submit even any number, NHS number, date of birth, or anything could identify your patients. And finally, before your submission, you have to contact the Royal College of Obstetricians and Gynaecology and contact the GMC, both of them before your final submission. They will guide you more, and they will allocate consultant to review your work.